So today our topic is pressure in cardiovascular system and hydrostatic pressure. So first we will discuss about pressure in cardiovascular system. So as we all know, the blood flow in the arteries refers to the movement of the blood through a vessel, tissue or organ, which is visually expressed in terms of volume of blood per unit of time. It is initiated by contraction of ventricles of the heart, and ventricular contraction ejects blood into the major arteries, resulting in flow from regions of high pressure to regions of lower pressure that are tissues. As blood encounters small arteries and arterioles, then capillaries, then the venules and veins of the venous system. So, here we will discuss how it all happens. As noted, hydrostatic pressure is the force exerted by the fluid due to the gravitational pull, usually against the wall of the container. Like here, the are arterioles and the vessels. One form of hydrostatic pressure is blood pressure, the force exerted by the blood upon the walls of the blood vessels or the chambers of the heart. Blood pressure may be measured in capillaries and vein as well as the vessels of the pulmonary circulation. However, the term blood pressure without any specific descriptors typically refers to systemic arterial blood pressure, that is the blood pressure of the blood flowing in the arteries of systemic circulation. So in if we consider of the components, as you can see here, there are two circuits in a circulatory system. One is pulmonary circuit and the other one is systemic circuit. So we all know this basic information. Now if we look at the pressure components, there are two components, systolic and diastolic pressure. When systemic arterial pressure, blood pressure is measured, it comes out to be 120 mmHg, and it is expressed as systolic pressure over diastolic pressure. The systolic pressure is higher value because it reflects the arterial pressure resulting from the ejection of blood during ventricular contraction or systole. The diastolic pressure is the lower value, which is usually about 80 mmHg, and represents the arterial blood pressure of blood during ventricular relaxation or diastole. So if we look further, now the pulse pressure. Generally, a pulse. If we will discuss about the another component, that is pulse pressure. Now, pulse pressure should be at least 25% of the systolic pressure. A pulse pressure below this level is described as low or narrow. So 30 to 40 mmHg is usually considered is the resting pulse pressure. As you can see here, the venous blood flow from the organs, the heart takes the pumps, it pumps the venous blood, the deoxygenated blood to the lungs, and from there the blood gets oxygenated and it is traveled to the heart by getting oxygenated. Now this oxygenated blood is pumped by left ventricle to whole tissues or organs, and from those tissues and organs the arteries and veins again travel that back to the deoxygenate blood to the heart. So these are the two circuits which are present in the body. So we often learn a great deal about the condition and the performance of the body by studying the distribution of pressure in and around the vessels. We all know that many people who have problem with high blood pressure and will be aware that blood pressure is taken routinely in course of general medical examination. There are many other pressure measurements made by the physicians and sometimes by medical physicists. These include respiratory pressure, bladder pressure, foot pressure, ocular pressure, and middle ear pressure, and so more. So we will recognize in this video that the pressure has the same unit as a stress, and indeed that a pressure is just a constant normal stress applied and around all the surface bounding a body, like we can see here in the arteries, the closed chamber of the heart, the lungs, and the body tissues. So we know that when we measure pressure using devices such as manometers or so we in fact obtain relative pressures. uh, Hence pressure that is lower than atmospheric pressure, like we know what the atmospheric pressure is because it's a constant when taken under constant values, is it is quoted to be a negative pressure. Now if we see this pressure in our cardiovascular system, so systemic circuit carries out oxygen rich blood to the major organs and returns oxygen depleted blood to the heart. The pulmonary circuit, I have already told you the now the position, it varies in with time and with varies with the position, temporal and spatial variation. The pressure is generated by muscular action of the heart and used to overcome viscous and other resistive forces as it drives the blood around the body. Now as you can see in this graph, we will see how the pressure decreases gradually, and it is at the end of the circulation of the circuit, it is parallel to the borderline. So here we will see the pressure where the pressure is found to be the maximum from this graph, and where the pressure is found to be minimum. So, during systole, the muscles of the heart contracts and the blood is ejected into the aorta and pulmonary trunk. During diastole, the muscle relaxes and hearts fill. So, high blood pressure areas are usually of the aorta because it has to transport the blood to whole body and tissues. The pressure distribution in the cardiovascular system is governed by the equations of fluid dynamics, and for a qualitative description of pressure variation will suffice. The spatial variation of pressure, as you can see, the low pressure areas are usually in the veins, as they have a low distancing power, and low distancing power, arteries have low distancing power than veins. So temporal variation of pressure decreases at increasing distance from the heart, so that the time the blood reaches the smaller vessels there is very little pulsatility. The damping of the pulsatility is attributable to the elasticity of the walls of the vessel in the cardiovascular system. As I already told about about the pressure, arterial blood pressure, which is also called systole, are of two types, systole and diastole. The systolic blood pressure can be about from 100 to 140 millimeter Hg. The diastolic arterial blood pressure can be from 60 to 90 mmHg. If we consider about capillary blood pressure, it is around the arterial, from the arterial end it is about 30 mmHg. And to venous, and it is around 10 mmHg. For venous blood pressure, smaller veins they have 3 to 7 mmHg pressure, and great veins like great saphenous vein present in the leg, it has a pressure of around less than 1 mmHg. So cerebrospinal pressure in the brain when we are lying down, it is about 5 to 12 mmHg, the pressure which is present in the brain. Gastrointestinal pressure is about 10 to 20 mmHg. Bladder pressure is 5 to 10. When the urine is stored in the bladder, the urine exerts some pressure, so that is known that comes out to be 5 to 30 mmHg. Now if we take mean arterial pressure, as you can see, diastolic blood pressure plus, which is equals to diastolic blood pressure plus systolic minus diastolic by 3. So as you can see, when we calculate this, it comes out to be 93.33. So the blood pressure, it is the blood pressure which comes out to be like the normal. This is the normal mean arterial pressure. The blood pressure of the patient is used, and it is of great clinical measure. This pressure is often measured using a device called a sphygmomanometer. So a standard procedure for use of this device is to be outlined. Now, our another topic is hydrostatic pressure. When we consider when we look into this topic, the hydrostatic pressure is the liquid in the tank varies with the height. At the bottom of the tank, the pressure is higher than it is at the top simply because of the weight of the supported on the lower layers. The pressure distribution that arises in a stationary fluid due to the action of gravity is called hydrostatic pressure distribution. The hydrostatic pressure at all points within a stationary continuous fluid varies only with the vertical distance from the surface of the fluid. As you can see, dp by dz equals to rho g. This is hydrostatic pressure distribution. The rate of change of pressure, which is dp, due to the weight of gas is small because the density is small, and we would certainly not be in concern. For example, with the variation of atmospheric pressure outside the body over the height of people, the hydrostatic pressure distribution is important clinically only with respect to liquids and to blood in particular. The density of the blood is close to that of water, which is around 1000 kg per meter square. Now, if we see this diagram, you know that the pressure in the vessel, the shape depends on the shape and size of the human body. So, it is filled with the blood. We know the human body is filled with the blood. Now, it would be expected to be more than 100 mmHg of mercury because the hydrostatic pressure effect. When a person is standing, when the person is standing, so we know we would expect the pressure in the blood vessels in the skull to be some about 35 mmHg lower than that of the heart, and that in the blood vessels in the feet perhaps 100 millimeter Hg higher. So the pressure present in the around the foot will be more than the pressure present at the skull, because the feet are at more height lower height than the skull. So when a physician take our blood pressure, he places the cuff around the upper arm at about the level of the heart. Since typical blood pressure measurement are of order 100 mmHg, the hydrostatic effect is clearly an important one. It is not surprising that lying down is beneficial when a person feels faint due to the reduced blood supply to the brain. Okay, the pumping pressure of the heart is not excessive compared to the height through which blood must be lifted, even without counting for any dynamic losses, and we operate on a relatively low factor of the safety. If we look at this picture, as you can see here, the r is the gravitational constant, which is around 9.8. It has a constant value of 9.8. So it is the acceleration, gravitational acceleration, which keeps the person down. Now if we take the pressure at the skull, it is p minus 35. Okay, now we know that the constant pressure, atmospheric pressure, is 1 bar, which is equals to 360 mmHg. This is the normal pressure which is around the person usually. So p minus 35, we can say that 760 minus 35 can be the assumed pressure at skull. If we take the p at heart, it is it is written as you can see here, p. So it is normal, like the pressure which is around the atmosphere, and at the feet p plus 100 because the height is more, so it is 100 times more.